Members of the subcommittee, I have House Bill 2147. The bill is was introduced to ensure that should any exchange be created in accordance with the federal health care law, that it would follow the agreement that was stated by the President, but also put into the code that no qualifying health insurance plan that is offered through the exchange will provide abortions.
Mr. Chairman and members of the subcommittee, my name is Tseng. I represent the Family Foundation, and we are in support of this bill. House Bill 2147 prevents qualified health insurance plans that cover abortion from participating in the Virginia Exchange, established or operating in Virginia pursuant to Section 1311B of the Patient Protection and Affordable Care Act, or the PPACA. Over 30 states have either passed or are introducing opt-out legislation regarding the coverage of abortion in state health insurance exchanges. 5 states already have opt-out laws, some dating as far back as 1978. House Bill 2147 is permissible under PPACA. Section 1303A of the PPACA permits a state to opt out of allowing health insurance plans that cover abortion from participating in the exchange, and therefore prohibit taxpayer money from subsidizing plans that cover abortions. The statute explicitly provides, and I quote, "A state may elect to prohibit abortion coverage in qualified health plans offered through an exchange in such state if such state enacts a law to provide for such prohibition." An opt-out like HB 2147 is necessary to prevent insurance plans that cover abortions from receiving federal subsidies in Virginia state exchanges. The PPACA uses federal tax dollars to subsidize insurance plans that cover abortions, which is equivalent to directly paying for the abortions. Section 1303 of Title I, Subtitle D, provides that qualified health plans may provide abortion coverage to enrollees. While the section creates an accounting mechanism designed to prevent federal subsidies from being used to directly pay for abortion through qualified health plans, this provision is a departure from the status quo on abortion funding. The Hyde Amendment and other federal programs, such as the Federal Employee Health Benefits Program, prohibit federal subsidies from supporting insurance plans that cover abortion, regardless of whether the federal dollars are used to directly pay for the abortions. And additionally, Mr. Chairman, I also have written testimony from Americans United for Life. They're a national public interest law firm that practices in abortion and bioethics. And I'd like to hand that out to the members of the subcommittee if possible.
Give that to our staff. We certainly can do that.
Take questions.
Delegate Lewis.
Can I ask Delegate?
Sir. I'm not clear on how these exchanges are supposed to work, so I need some clarification. Because typically I've voted against any introduction of federal or state funding to abortions. So my limited understanding of how these exchanges are supposed to work is it's supposed to be a marketplace where private plans are available and made available. And so I guess my question is that correct? As to how the general fundamentals of the setup is supposed to be these exchanges, and secondly, is there going to be any state or federal, obviously the Hyde Amendment, I would think, as the lady referenced, is going to prevent any federal money from being in there. Is there any chance that state money will somehow flow into these plans?
Delegate Klein. The exchanges, you're correct, they are set up by the state for private insurers to participate in, provide certain minimum level of coverage, and that is being determined by the federal government right now. What is going to be covered? Is autism going to be covered? Is it not? What are all the different types of coverage that are going to be provided? Those private insurance companies are going to be subsidized by the federal government as they keep rates low for those who participate in those plans. To the degree that the state will be directly contributing to the exchange, I'm not sure exactly what our level of involvement will be. I don't believe there will be direct funding, but I think there will be some support through the, I believe believe it is through the Medicaid program that we will be providing some support.
Short answer is yes, that's basically how the exchanges are anticipated to work. They're supposed to be situations where approved insurance companies can come in and offer health insurance plans that provide minimum essential coverage. The issue with respect to is there going to be state funding for them is, I don't know if it's responsive to the question or not, but initially there's an individual exchange, and there's also going to be a small business exchange. And no one really knows because the exchange for Virginia has not been set up yet, but through the exchange it's supposed to be a portal where individuals who are eligible for subsidies, and there are federally funded subsidies for persons based on the type of policies being purchased and the amount of income that's provided, so that persons, I believe that's up to 400% of the poverty level, will be eligible, depending on family size, for some element of federal subsidy. There's also supposed to be a provision that provides that if you turn out to be eligible for benefits through other state programs, for example, one of those is the increase in Medicaid eligibility for everyone up to 133% of the federal poverty level. So if you go to the exchange and it turns out you're eligible for the Medicaid program, you're steered to take advantage of that benefit. But in terms of state general fund dollars providing subsidies, I'm not aware of how that
There may be some federal flow through to the state, but it's going to be a sliding income scale, and you'll be subsidized to the degree of your income.
But Mr. Lewis, I mean, I guess to Frank too, at this point, I mean, the feds can't subsidize abortion services, can they?
That's my expertise, but I believe that's part of the high demand. But there's a provision in, as was mentioned, there's a specific provision in the PACA, the federal healthcare law, that gives the state the option of opting in or opting out with respect to the policies sold in exchanges providing this type of coverage. Which I guess it's separate from the question of whether or not there's going to be funding. The funding that's provided for the subsidies, as I understand it, is federal. It's being done through the tax code. In essence, it's going to be like tax dollars are going to be used. It's not, for example, not Medicare funding, Medicaid funding, and that's going to be a straight federal general fund funds that are used for the subsidies.
Louise Hartz from Monroe County, representing the Virginia Society for Human Life. We are in favor of this legislation. Thank you.
Caruso with the Virginia Catholic Conference. The federal law did, one serious deficiency in the federal law was that it permits health plans that cover abortion it permits them to receive federal funds. And there is, as the gentleman mentioned, there's a provision in the federal law which allows states to opt out of that to make absolutely sure that public money that our taxpayers pay does not have to go for abortion. So that's what the bill aims to do, and I know that there are some other states that have already implemented this policy. In terms of why it's especially appropriate, you're talking here about a state-sponsored forum, and so we think with the fact that there are going to be tax dollars involved, and there is something that the state is going to be actively promoting in terms of an exchange, that it's particularly appropriate to make sure that taxpayers are not going to have to pay for life-destructive practices. So for those reasons, we urge a favorable report on this.
Mr. Chairman,
Delegate Joanna.
are you saying that the state of Virginia will have money in that exchange? Is that what you're saying?
My understanding
Or is it federal money?
Well, my understanding is that it's both.
It'll be state and federal, is what he's saying.
All right.
Mr. Chairman.
Bill Lewis.
Could Mr. Gray come up? Maybe he might be able to shed some light on this.
All right. I'm not sure which side he's coming up on, or maybe as a
Need information?
interested part, informed party.
I'm Doug Gray. I work for the Virginia Association of Health Plans. We do not have a position. We sell policies that include and do not include. The way the exchange generally is going to be structured is that 400% of federal poverty and below will be in the exchange. Up to 133% will be fully subsidized by the federal level in the beginning, and then a small share of the state as the years go by. The others will be subsidized on a sliding scale basis from 133 all the way up to 400% of federal poverty. The one using federal funds in the beginning and state funds later as the state responsibility kicks in later on. If you're extending the Hyde Amendment, all of those folks are included, basically. And so they are all getting subsidies. The one group that is not getting subsidies is there are people who can buy in the exchange who will not be getting a subsidy. And that group of people is not getting any state or federal subsidy.
All right.
Well, they won't get any subsidy.
Sounds like we're getting a definitive word then on that.
So there is a small group. That's it.
So, Mr. Chairman,
Doug Lewis.
can I ask the patron a question? So I understand what the light that Doug has just shed on this. So eventually there will be some state funding going in there that could arguably go to subsidizing the policy that has provides abortion procedures. I understand that. But I also understand from what he's saying is that there are going to be policies in there that are non-subsidized. So what I'm getting at, I guess my question is, do you think perhaps, given the respect we all need to show for the free marketplace, are you painting with too broad a brush? I guess is what I'm asking. Is there a way to narrow your focus?
I think the policy holders may not themselves be subsidized, but the plans that are offering those policies may be benefiting from those subsidies. And anyone who is participating in the exchange as an individual may not be receiving federal subsidies, may, through a different policy of ours, be receiving state subsidies. We don't know yet. This is to guard against that instance. In the instance where they're not receiving any subsidies, they still may be purchasing a plan from a provider that does offer and is receiving subsidies, offering those plans to other individuals.
All right, move on.